We are breaking down the most full throttle 3 things that you can do for your skin to keep you looking young and vibrant. And nobody better to tell us the deal here with expert, famous plastic surgeon, Dr. Rohrich. Rod, if there's thousands of products out there, what are the 3 best things people should know about, and tell them what they need to do?
Right. I mean, you're right, Bill. There's so many things that people talk about. Dermatologists, plastic surgeons, but the three essentials are everybody should have a sunscreen on. It's obviously SPF, sun protective factor, 30 or more. Obviously the blocks are better, like zinc oxide, but people don't like it because it's opaque, but it's better especially in the Texas sun. And then the antioxidants, they are a potentiator, especially in sun-damaged skin, Texas. But everybody should have an antioxidant because it potentiates the next one, which is vitamin A, okay? That's key, and it's the retin A. And everybody always says, well, what is retin A? And now retin A is the prescription form of retinoic acid. So that's the strongest thing you can put on your skin, and it's the science-based skincare because it helps turn over your skin, the epithelium and the deeper dermal layers, instead of every 6 weeks, every 6 days. And why is that important? Because of the fact that it actually eventually will thicken your skin and get rid of wrinkles, but it takes months and months to do that. Here's where the confusion comes in. There's a retinol, and then there's a retinaldehyde. See, these are all over-the-counter types of vitamin A, but they're not as potent. The retinaldehyde is actually the most potent that's over-the-counter. I like to use it in my patients that are starting out, because it's very retin A is very, very sensitive, especially if your skin is fair. So retinaldehyde, but if your skin is very fair, try a retinol, which has got a little less potent than retinaldehyde. So it's retinol, retinaldehyde, and then the big kahuna is retin A.
All right, I've got a few questions. So on the sunblock, so SPF. So what exactly, you said 30, but what exactly is SPF?
Well, it's sun protective factor, and basically there's UVA and there's UVB. UVB is what you want to protect against, and a simple way to remember that is UVB is burn and UVA is aging. So anytime you want to try and protect your skin, you need at least that barrier of a 30 or more, because a lot of the sunscreens, especially the ones that are kind of cheap, they'll be 10 or 15, don't bother. And there's no such thing as a waterproof one either. Basically, if you're out in the sun, you should apply it every 2 to 4 hours. And if you're in the water, you really need to apply it after you get out. There's no such thing as a water protective sunscreen. There isn't.
The next one you talked about is the vitamin C's, antioxidants. So how do those come? Like what do you go out and buy?
Well, I think the biggest thing is you got to make sure that they are L-ascorbic acid, and that's vitamin C, that it's got to be absorbable through the skin. And so when you make sure you get one that's truly absorbable through the skin. And you can apply that morning and night. I mean, and I usually have them do it before they do the sunscreen, but it really helps as an antioxidant to help nourish your skin, but also help your damaged skin, and then it potentiates the action of retinols. And so I think those 3 things are the key components. I mean, there's a lot of other things, moisturizing and stuff, but if you're only going to do 3, those are the big 3.
Yeah, and like the retin A and the retinols and the retinaldehydes, and to a lesser degree because the over-the-counter stuff is weaker.
Right.
But there's good science that it actually builds collagen.
Oh yeah, absolutely, especially with the retin A. And gradually, people should start it 2-3 times a week. Then they can actually go to nightly. Don't just blast yourself every night, because what'll happen is then you're going to get red, and then you're going to not use it.
Right.
People don't like to have irritated skin. Right.
And if you do get red, then take a day or 2 off and then restart it.
Right.
So yeah, that's the thing. You got to kind of get past that part where you get to build up a little tolerance, and then. But yeah, I think the retin A's and that family is it's been around a long time, but it's really the mainstay of a lot of the really good skincare regimens.
It's the basis of science of skincare.
Yeah,
it truly is.
All right, great stuff. But if you like that, check out this video on plastic surgeons discussing the perfect patient.